Today I am going to talk about to make a decision regarding single visit or multiple visit and non-tax. How to decide case to case. The only dilemma to complete root canal treatment in single visit is this question in mind. That is, I have achieved proper disinfection of root canal or not? Do I need to place an intracanal medicament for a week to achieve complete disinfection? This question is subjective because you can't do a chairside culture test, because to do a culture test it requires 48 to 72 hours. So clinician should answer this question by different method based on his experience and literature. Literature and research says that you can do single visit treatment in all cases except Vaping canals, that is in acute apical abscess cases. Vaping canals are the cases where continuous drainage from canal occurs and clinician fails to achieve the dry canal. So vaping canals are absolute contraindication of single visit RCT. That's clear. Now what about non-vital cases? You can say cases with diagnosis of necrotic pulp with either symptomatic apical periodontitis or asymptomatic apical periodontitis. Symptomatic apical periodontitis means when symptoms like swelling and pain on biting are present. Swelling cases are not absolute contraindication. An experienced clinician can achieve disinfection in such cases with effective BMP and copious irrigation and its activation. But swelling means there is exudate in periapical tissue, and if during BMP some amount of necrotic debris is extruded in periapex, it can worsen the symptoms. So such cases can be completed in 2 visits to be on safer side. Cases with sign of tenderness on percussion also comes under symptomatic apical periodontitis. Such cases can be done in single visit but with precaution like avoiding debris push. This can make sure if you follow crown down pressureless technique. Same concept applies to silent necrotic cases. That means asymptomatic apical periodontitis cases. These are the most challenging cases when initially there is no symptoms before treatment, but after treatment symptoms comes in action. This happens because of body immune response to treatment. I have explained this by mountain pass theory in another video. So for a general practitioner, it is also a relative contraindication of single visit treatment. Some of such cases with large periapical lesion should also be completed in multiple visits. It is not possible to achieve complete disinfection in such chronic cases. This is because there are high chances that bacteria invade in dentinal tubules up to 400 microns because of long-standing canal infection. So except cases with large periapical lesions, main worry is post-operative symptoms because of debris extrusion, not canal disinfection. After introduction of multiple advanced technologies like efficient rotary instruments, irrigation activation methodologies, sealants with antibacterial properties, etc., effective disinfection has become possible. But because of immune response and interaction of body cells and bacterial toxins, exudate formation can occur even after good canal disinfection. This can cause pressure buildup in periapex and results in postoperative symptoms. I explained all this to take decision in cases where intraoral sinus is present. In such cases, exudate can drain through the sinus and chances of post-operative symptoms reduces. So it's difficult to digest, but yes, if you are sure that you have achieved proper disinfection, you can do single visit endodontics in sinus cases. Now coming to vital cases. It includes irreversible pulpitis cases and intentional RCTs. So question arises, what is the benefit of giving intracanal calcium hydroxide in such cases? Apart from antimicrobial property, calcium hydroxide can dissolve vital pulp tissue through necrosis. This means if you are doubtful that some pulp tissue left in the canal even after completing biomechanical preparation, intracanal medicament, that is calcium hydroxide, can be placed for a week. So vital cases are perfect indications of single visit RCT. To conclude, I can say that weeping canals, large periapical lesions, and swelling cases are contraindications, and irreversible pulpitis cases are indications of single visit RCT. Remaining cases are subject to clinician's judgment of his canal disinfection. Thank you.